Hello, everyone. I'm so sorry for the delay. It seems that Sandra is having some technical difficulties, so you get me today to do the introduction. So welcome to the second day of our Planning for Seniors Housing and Changing Cities conference. I'm Christine Shepard, and I'm one of the members of the Planning Committee, and I'm so thrilled that you have all joined us today for our second day of our event. We have another exciting day of speakers to help us examine the best practices, emerging research, and policy solutions to support the health and well-being of older adults who live in low-income housing. Since this is a two-day event and some people might be new, I'm going to do a very quick recap of some of the main points about navigating our conference platform that we covered yesterday. So this is a picture, next slide, Christian, thank you. So this is a picture of the main room. I know Remo is maybe a little bit new to some of you, but hopefully you're getting more comfortable now as the days have gone on. We're in our second day. I wanted to remind people about how to navigate some stuff. So you're all sitting at a table, and this is what floor plan view looks like. So when we're not in broadcast view, when we're in the other mode, you'll have an opportunity to talk to the folks at your table. You can move between tables if there's someone in particular you want to meet with or talk to. If you grab any of the white space in the room, you can push down and you'll see a bunch of blue buttons along the bottom. This is where you can find some relevant documents like the agenda, the link to the student poster competition, and our evaluation form. Some of our speakers from yesterday and some speakers today have shared some documents as well that you can access here. So along the sides as well, the green buttons are where you can learn about the concurrent sessions. And if you click on the green box, it will tell you which session it is and if you want to navigate to that one. Kim, our tech support, has also linked the direct links to these concurrent session rooms, both in the email you received yesterday, and it'll also be linked in the chat box. If anything comes up, the UHN conference staff are absolutely fantastic, and they will help you with all of your tech needs and problems. So please just reach out to one of them through the chat, and they're more than happy to help you. Next slide, please. Today, from 5 to 6 p.m. on Zoom, we have a great opportunity for trainees, students, and people who are just new to the field of seniors housing to come and learn from some experts who've been working in this field for a while from across the research, the policy, and the practice spheres. The Zoom link was sent out to you in your email last night, but we'll also post it in the chat at the end of the day. So please come and join us if you'd like to learn more about how you can be engaged in this sector. Next slide, please. So I am incredibly thrilled to introduce our opening remarks today, Anita Dressler. She is a tenant that I've had the pleasure of getting to know over the past year. She lives in Toronto Community Housing and is a strong advocate and leader in her community. She's very passionate about the health and well-being of older tenants, and I know that you're going to love listening to her speak and share some of her experiences about how to foster meaningful tenant engagement in your communities. Please join me in welcoming Anita.
The camera. Oops. Hi.
I think you're good, Anita. I can see you.
Thank you. Thanks, Christine. What a beautiful day. The sun is shining and birds are singing and all the rest of it. I'm sure that you have enjoyed this virtual conference. The coordinators, technicians, and people behind the scenes should be applauded. You did an excellent job. My name is Anita Dressler. I've been a tenant at Toronto Community Housing for 10 years. I've volunteered since my early teens, which is more years that I want to remember, more than 60 in fact. Where has the time gone? Well, in the past, I never thought that I'd become an advocate. After all, in my policing days, advocates were a bunch of noisy, placard-holding people that were very aggressive and had to be held back. To my surprise, for the last 8 years, I've been an advocate in housing, transportation, and health. It all started with a sign. There was a gigantic sign outside my building stating that this building belonged to Toronto Community Housing. It was embarrassing to be stereotyped into everything that I had fought over the years for my children not to be in. I found it humiliating. I set forward into an investigation to find out who was responsible for taking down these signs and replacing a small sign with only the address. Once I found out who that person was, signs went down. I quickly realized that our tenants started taking pride. They started walking different, looking at things different, inviting their friends and families in. The next step was to take our building out of the institutional colors of the 50s, burgundy, pale yellow, and the sickly green. With a little effort, the building was repainted with the rich colors of today, charcoal gray for doors and frames, and light gray for walls. Tenants started taking pride in the building. They started planting flowers and plants. The landscaping here is beyond none. Welcoming everyone to see their building and giving their friends and family a guided tour. The pride where they live shone on their faces. Don't forget, perception means a lot. I've never participated in marches, screaming matches, or stormed City Hall with my beliefs. Instead, I chose to advocate a different way in housing. I went to meetings. I listened to all the issues and decided that there was no group that was actually available to address the real tenant concerns. I co-started a group named Seniors Voice. Our mandate was to help other tenants to resolve issues that had been ignored for years. A small group of seniors met and we stepped on staff's toes. We went to buildings in Toronto community housing, family, adult, and senior. When we went to these buildings, we identified many issues: broken windows, repairs in apartments, things that had been neglected for 10 or 20 years. We listened to the real concerns, including the fear of eviction. Tenants did not believe that we could make a difference, but we did, and we also referred a lot of people to Cynthia Summers of OACH. After every meeting, a concise, detailed report was written and sent to the managers in the different departments to fix the items that we identified. We held them accountable: repairs, pest control, security patrols, and everything else that had to be done immediately. Before long, staff were actually wanting us to attend and report. We were actually doing an audit for Toronto community housing. Tenants started calling and asking, "When are you going to come to our building?" We involved facilities, pest control, tenant services, OACH, agencies, security, and other resources. We held both staff and tenants accountable. When this group started having problems was when staff tried to take over what we were doing, and they failed miserably. We started over, and we focused our energies and our focus on senior buildings and created C.E.T.S, Senior Advisory and Advocacy Council. Same mandate, same principles, and same accountability. C.E.T does not receive any funding. Our members are loyal and passionate, and we hand out our own money for transportation, snacks, coffee for other tenants, and administrative needs. Between Seniors Voice and C.E.T, we actually attended over 225 buildings. We took information pamphlets with us, which included Wheel-Trans, which is the Toronto Accessible Transit, Safety Hints, the City of Toronto Senior Strategy, OACH, Resources for Seniors, and how to contact those resources. We had this information translated into numerous languages. After all, our buildings are diversified. I'm telling you all of this because I don't want you to think of us as the seniors of the 50s sitting in a rocking chair waiting to be led, but as vibrant, experienced souls with a bag of tricks up our sleeve. We like to be guests to agency programs, but don't expect us to clean up after you. We're too smart for that. If it is your program, then you do the work. When it is our initiative, we will do the work. We know how to organize and make sure that everything runs smoothly and help each other to clean up. We are pleased to have staff and managers join us. We enjoy programs where light lunch is served, music for us to dance, sing, and clap our hands to. After all, music is universal. It stirs the very bottom of our soul. Funding is our requirement for proper engagement. We have stirred up many discussions with management and staff, and in the end, it's a collaborative message and action that gets things done to the satisfaction of everyone. One of my most memorable moments was a very sad moment that impacted our whole community, our staff, and staff from other buildings. Our superintendent died of a heart attack on the weekend. He was young and vibrant on Friday, and he was gone on Sunday. Our tenants and many staff from other buildings were in total shock. He was a really great guy and a terrific superintendent. Our building needed healing. I took it on myself to have a memorial service for him 1 month after his death. I relied on the members of C.E.T.S to help me. Word went out to management staff, his family, tenants, and those that had worked with him. 150 people later, the service was held. The CEO gave a heartfelt message to his family. Our tenants wrote poems and collected $1,000 and gave it to his mother, and another $500 for trees and plants to be placed on the property in his memory. We rose to the occasion. Those tenants who did not speak English had their words translated. We're a very diverse community. Our tenants speak Russian, Farsi, Spanish, Korean, Cantonese, and Mandarin. Even though we have cultural differences, we still have programs, special events, and we help each other. We were fortunate. The very best friend of our beloved superintendent took his place. At first, the tenants didn't want to give him a chance. I convinced him to take a week off. During that time, management worked collaboratively with me, and we painted the office and brought in a new desk and chair. This was his office now. When he came back, he was overwhelmed that this had been done for him. This was his new home. And believe me, he's told me many times that he'll stay here till he retires. Shortly, tenants realized that they also had a great superintendent. This was a win-win situation. At the end of the summer, it was time for something different. I started planning a barbecue. The agency that works with us provided staff to serve food and paid for a musician to entertain. Management staff rented 6 large gas barbecues for our use. This is another example of joining together and listening to the programs that seniors really want, not what is directed by well-intentioned staff. And where staff are willing to be part of good engagement. A tenant who drives took me shopping, and we bought food to meet every dietary need or want. Meals, chicken and fish, salads, fruits, desserts, and other treats. Sorry about that. We got a hold of managers, and we turned around and we said, "You're going to do the work today." And they did all the barbecuing. Our tenants enjoyed the music. They danced and they sang to the musicians. Staff were put to miscellaneous duties. And once again, I said our managers were put to barbecuing. Everyone was friendly. Managers were introduced to each other. Managers who had received emails or phone calls for many years, but never met the person. A bond was created. And when someone needed something, departments started to work together and not against each other. How can you possibly say no to a colleague, the person that you just bonded with? Tables were set with soft blue tablecloths and vases of sunflowers. We wanted a cheerful experience. We actually had over 250 people show up. Agency staff, management staff, community safety officers, our city councilor, provincial and federal politicians, our tenants and staff from other buildings. We even had an unexpected occurrence. The famous snowbirds, which flew over the exhibition on the last day, actually flew over my building at precisely the same time that the barbecues were turned on. Everyone was cheering, thinking that it had been planned. They even went in and out of formation for us, but it was actually a fluke. 2 years later, staff and tenants are still talking about the barbecue. We're looking forward to another event after COVID. If you remember that many seniors want programs because they're lonely, our programs stop depression and isolation. Seniors want to be useful, not shut away or ignored. Please include us. This will create vibrant, healthy communities. During COVID, I arranged for different balcony concerts. The agency that we work with also arranged balcony concerts. The musicians and singers stayed for 45 minutes on each side of our building, playing the music of the people, Russian music, Middle Eastern music, English. Everybody was elated. Our tenants stayed on their balcony. They sang, they danced, they clapped their hands. Some went in and got their own instruments, violins and accordions playing with the musicians. The musicians were so appreciative that they were there and people joined in. And our tenants who were entertained were overwhelmed. The programs didn't cost a penny, just some organizational know-how. 350 tenants entertained on different occasions. What a lift to their spirits. Seniors appreciate every effort that's made for them. Start to be creative in your programming. I'm going to leave you with a message. You have a hard task, idealistic viewpoints, but in the end, what is needed is a collaborative effort. Tenants do not know that so much work is done behind the scenes. And in return, you either have too high or too low of an expectation of us. Start making a compromise. Make it between the high and the low for real success. To our younger group, if you want a rewarding career that will make a difference, think of working with seniors. You will have many frustrating days, I promise you that. Much joy, a family made up of your own. These clients will be an extension. They will be embracing you. You will be a new family member. Seniors have a lot to offer. They have history and experience. My community is a family, and that includes our staff and managers who drop by for other business. Tenants are happy to see them. Before COVID, you could see tenants going up to these managers, giving them a hug or a pat on the back. This is not by accident, but by example, and what can and should be done. We notice when buildings are run down or need a good cleaning, as we are embarrassed to bring our friends and families in. We notice when a senior tenant is out of control. Everybody chips in and does what they can. We notice when someone is lonely or in need of something. We need engagement programs to motivate our mental, emotional, and physical well-being. We were once young and vibrant, rushing around, no time for anything or anyone. Does that sound familiar? Stop. Take a pause. Think for a minute. How would I want to live after I retire? Think about how lonely you might be, outliving your friends and family. Think about what you can do to help close that void. Programs where you as professionals can come up with solutions to work collaboratively with seniors. Make them your friend, not just a case number. You will learn a lot. Don't forget, seniors have been there and done it. We know what hardships are, and we know what you face, but we also know when someone is telling us a story why things aren't done. Seniors are in housing because of a twist of fate. Many are immigrants who bring a wealth of history and amazing accomplishments. Other seniors have been educated or developed skills that would also amaze you in a lifetime of experience. We have been engineers, enforcement officers, worked in health or social services, chefs, involved in the arts, and many more worthwhile occupations. Be honest with your tenants or your clients. It will not come back to bite you. On closing, I'm wishing you a very healthy, rewarding experience at this conference and a fantastic future working with seniors. Don't forget, praise where it is due and criticize when warranted. Thank you for listening. Have a great day.
Thank you, Anita. Can everybody see and hear me? Yes, thank you. That was wonderful to hear from Anita. I'm Sander Hitzig. I'm one of the conference organizers. Unfortunately, due to some technical challenges, I couldn't get on to open remarks, but thankfully Christine Shepard was able to step in. Anita, we are so grateful that you were able to open our conference today on day 2 to share your reflections and talk about the importance of the work that you're doing to build a sense of community at your building and with seniors at Toronto Community Housing. And actually is a wonderful segue into the talk that Christine and I are going to give today around building effective research and partnerships for advancing housing outcomes for seniors. So I'm going to this point and move on to our talk. People can see my slides. If I can get a thumbs up. Okay, I'm seeing Christine. So everyone, hopefully Anita will be here for the day and we'll have a chance to connect and hear about more of her thoughts and important insights. So again, I hope everyone's enjoying the conference so far. I want to thank you for joining Dr. Christine Shepard and I to hear about our talk on how to build effective research and public policy partnerships, which we're going to highlight by talking about our own seniors housing initiative that we've been working on since 2019. So before starting, I just want to flag that we have no conflicts of interest and that this work's been supported by the Canada Mortgage and Housing Corporation, as well as by a CIHR fellowship that's supporting Christine's postdoctoral fellow. As I mentioned today, we want to showcase you all the approach that we use to form meaningful collaborations with all the community partners engaged in this housing initiative, which can be challenging because, as you know, we have to take into account not only the needs of the seniors living in those buildings, because we, ultimately we need to have services that are that can meet their needs and that they feel are suitable, that are culturally sensitive and can address all of their concerns. There's also tensions that city and frontline staff have to contend with in delivering housing services. And as well, how do we create strong working relationships with other independent community agencies that are supporting seniors in the community? So there's a lot of different viewpoints, a lot of different perspectives that we need to bring together to hopefully come up with new solutions for seniors housing. So to help explain this, we're going to cover how this initiative started, a little bit about seniors designated buildings at Toronto Community Housing, the methods and the theoretical approaches that we use to make meaningful connections with all the different groups that were involved in this initiative, what we found out, and then we're going to try and tie it all together in a set of recommendations that may be helpful to some of you trying to work or wanting to work in a collaborative research, practice, or policy space. So if anyone online today is the type of person who likes to read the last page of a book, first, I'm going to give the ending away. And this is really our main recommendation, which is really about taking the time to make meaningful relationships. And again, it was wonderful to hear about Anita and all the efforts that she did to make strong, meaningful connections with all the people involved, in her building. And on the surface, this may seem very simple. Why can't we just, work together and make things happen? But really, a lot of times, I see a lot of initiatives fail because even though you can bring a group of people together to work on a common goal, people may have different priorities related to that goal or even have different approaches on how to achieve them. So if you put in the necessary time and the necessary structures and other processes to foster communication, to understand these dynamics, then it can lead to feelings of trust, which then hopefully leads to positive outcomes for everyone. So first of all, some of you might be wondering, why is this rehabilitation researcher talking about housing? It seems a little bit of an odd fit at first. And it's something that even I get asked by a lot of my colleagues at Sunnybrook Hospital as well. So there's a few reasons. One is that my research program is focused on understanding the long-term outcomes of people with disabilities and other health issues, and this often takes me beyond the walls of the hospital. So it's really about understanding, what's happening in the hospital and is it translating into good outcomes when people go back home. As well, Sunnybrook Hospital actually has a large number of seniors coming to our Center for Health, and is actually a huge strategic direction. So it makes a lot of sense that we're looking at seniors issues. Finally, and it goes back to this relationship component, I have a long-standing relationship working with the City of Toronto's Senior Services Division, where I've been very fortunate to work with Andrea Austin, who's the manager of Senior Services and Long-Term Care Division. And she's really been one of the main collaborators for a lot of the work that we've been doing over the years. Andrea and her team are such amazing collaborators. And we've been finding ways to support and evaluate a number of excellent initiatives that she's been leading on seniors-related issues. And this has included in the past getting small grants to identify how we can actually work well with the city and their partners by ensuring that we are pursuing topics in a way that's important to them. And here we are a few years ago competing for some dollars for some of the work. So what we got that sort of kickstarted all this work was a small CIHR planning grant, which funds groups to come together to plan for larger grants. So it's actually a really ingenious idea by the federal government to give very small pockets of money to bring groups together to say, okay, who are you? What do you want to achieve? And can you come up with a plan to come up with a really strong project? So during one of these planning sessions, the issue of seniors housing came up as a priority. And this not only came from our city and community agency partners, but also from members of the healthcare team. And I'll be honest, I was a little bit surprised that, a number of the doctors who were at this meeting, they were saying, like, we really need to do something about making sure our patients have appropriate housing, that they can go back home, that they have the right supports, that it's safe. And, I think a lot of you here today will recognize that housing is a health issue. If you're living in a house that's not, safe, even if it's a negative environment because of social reasons, or if it's not accessible, then that can lead to stress, or, if somebody's bathroom isn't properly set up, they can slip and have a fall, cause further injury. So it's really well recognized that housing is a health issue, and it's great that it was recognized not only by people working in the community, but also at Sunnybrook as well. So it was great to get that buy-in. So with us in mind about housing, our group decided to pull together a project to support the efforts of Toronto Community Housing, or TCHC, which is a city-owned corporation. And our next set of speakers, Andrea Austin and Joe Bada, and I believe we have a guest from out west, Shanika. They're going to go into more detail about the actual TCHC, but just to give you a quick flavor, TCHC is North America's second largest social housing corporation, and it operates 83 buildings that are designated specifically for seniors. And these senior designated buildings are home to approximately 14,000 seniors. And you can see on the map all the different locations across the city of Toronto, so pretty widespread. All of the leaseholders in these buildings must be aged 59 years or older. And these buildings are often located in city neighborhoods that have a high proportion of seniors who are living alone. Almost all the units in the to income, and approximately half the units are bachelor apartments, and the other half are one bedrooms. Some of the buildings are quite large. There's one, I think, that has up to 400 units, while others are quite small, with one as few as 11 units. So in terms of the service delivery model, there were a number of issues that were identified. One is that senior tenants are disproportionately impacted by poverty, social isolation, and health challenges. And Anita talked a little bit about that in her opening remarks. As well, nearly 90% live alone, about 40% have a disability, and 40% speak a language other than English. So this is a group of tenants with a high number of needs that could easily, get them into a situation that might put them in arrears and in a worst case scenario, get them evicted if a crisis situation should arise. So one of the reasons that some people may have difficulty or get into a crisis is that the staffing model at TCHC made it difficult for staff and tenants to regularly interact. Obviously, some buildings there were better relationships, but in other cases, it didn't always pan out as planned. There are staff that are designated to help tenants, which includes helping them, refer them to health and social agencies. But one of the challenges was that they often had to travel to different buildings, and they were limited in numbers, so that made it very difficult for them to form meaningful relationships. And then sometimes that really meant that they could only step in when a crisis happened. So if somebody's hoarding went out of control, or if there was another situation where somebody had dementia and their behavior got so out of control that they were at risk to themselves or others. So that's usually when they stepped in. So this wasn't an ideal situation. And this doesn't mean that the housing staff were the only source of support. There were a number of community and health agencies that do go into these buildings that are providing services to seniors. But again, these services were not well integrated with the housing side of the house. And even though there are all these different agencies going into the different buildings, they weren't always interacting with each other. So it was a little bit of the left hand and the right hand not knowing exactly what was going on. So in order for, to age in place, senior tenants need access to services, integrated supports, so that they can have successful tenancies, which was lacking at TCHC. So they recognized that that their current service model was not meeting the needs of senior tenants. So TCHC, the City of Toronto, and their partners wanted to come up with a new integrated that would facilitate access to services for tenants so that it would ensure that there were more integrated supports to foster a greater sense of community within buildings, which should then, in theory, lead to successful tenancies and then enable tenants to age in place. But to develop these new staffing models, there's a need for new procedures, new policies for this new integrated service model. I'm going to call it the ISM from this point forward. And unfortunately, the city lacked resources to ensure that all of this planning and implementation of the ISM could be evidence-based. This doesn't mean that they weren't doing outreach and talking to people and doing planning, but to be able to go to the literature, do research, to do in-depth consultations, that takes a lot of time, energy, and effort that unfortunately, the city works with limited resources, can't always, do this in-depth planning that they would like to undertake. So again, because we had this great working relationship with the City of Toronto, we got this small planning grant where we identified a priority to work on, in this case, supporting TCHC with the planning of the ISM. We successfully applied for a grant from the Canada Mortgage and Housing Corporation to provide them with the resources to co-create, implement, and evaluate their new integrated service model. And what we did is we used something called implementation science, which is a good approach to use when you're trying to introduce change or a new intervention in a real world setting. In this case, we not only wanted to help them create this new ideal ISM model, but we also wanted to make sure that they would be successful getting the buy-in from the tenants, the staff working at TCHC, the community partners, and the tenants themselves, to make sure that, when this model came out, they would feel that some ownership or that they would recognize that it was tailored to what their needs were. So just to give a little bit of background, implementation science is a study of methods to promote the adoption and integration of evidence-based practices, interventions, and policies into routine healthcare and public health settings. And this field of study came about because only about a third of new evidence-based practices ever make it to routine clinical practice. So these great ideas that may be happening all over the place, only a third of them ever actually get effectively translated. And those that do, it takes on average about 17 years for it to make it to the front line. So that's a long time from a good idea to execution. And those are the teenage years, which can be quite difficult. So my daughter, she's starting, and I'm starting to feel that a little bit. So anyways, so when these ideas come into practice, they're teenagers. So this is just an example to sort of showcase why implementation science is important. And I'm going to talk about scurvy. So you're getting a little bit of everything: seniors housing, implementation science, and scurvy. So the scurvy was a huge issue, back in the day when sailing was the prime means for getting goods and services across. It was a driver of the economy, and people on boats were getting quite sick and dying from it. So Dr. James Lind, who ran the first randomized controlled trial, found the cure, eating citrus fruit. And you would think, this great idea would be taken into action right away. But it actually took 4 decades for it to be translated to routine care because, even though there was evidence that it was highly effective and there was a need for a cure, it was like a pressing issue, it just didn't happen. And so why did this happen? There are a lot of reasons. One was, there was a failure to understand what needed to go into place to actually get it into practice. One of it was around they didn't promote it. They didn't talk about the solution. So there was a failure to sell the treatment. There were also issues around the government not knowing exactly what to do or how to move it into action. So there are all these different factors that came into play where, they had this cure. It could have been rolled out very quickly, but unfortunately it took 40 years for it to actually, get to the sailors and be effectively addressed. So obviously, for our housing initiative, we don't want this to take 40 years. So what we did, as I said, is we used implementation science, and there's lots of models that are out there. We used something called the Consolidated Framework for Implementation Research. And really what it does, it's just a framework that highlights a number of factors that will influence implementation. And we really wanted to make sure that we would take this into account when thinking about the housing model. So this is the model very broadly. I'm not going to go into all of it, but basically it highlights different categories that you should take into account. One is around the characteristics of the intervention itself. So what is this housing service model going to look like? Is it complex to roll out? Would it be adaptable to the different buildings? How does it look? Is it packaged in a way that would be attractive to the staff who need to roll it out? Things like that. Also around, is it meeting the needs of tenants? So is it, the outer setting? So one of the things is around, here it says patient needs, but we can replace that with tenant needs and resources. Other things are around the people who are actually working in those buildings. Do they feel confident about the model? We need to identify a local champion. So there's all these different things that we took into account as we were planning the housing initiative. And so with this model in play, we came up with a 5-step process, which each step was informed by this implementation model. And again, it really was done to make sure as we were developing it with the city and everyone, it could be successfully rolled out. So this included helping Toronto Community Housing and the City of Toronto identify all the relevant players who could contribute to the planning of this model. So who in the community did we need to talk to? Which tenants did we need to reach out to? We needed to then generate the necessary evidence so that the City, Toronto Community Housing would have the best research at hand to make evidence-based decision-making. And then what we did was we took all the evidence and we found all the people that we needed to talk to, brought them together to co-create what this model could look like. So we tried to make opportunities for people to be seen and heard on what they needed. And then we've been able to co-create this model. It's being rolled out shortly. And and we now have some great tools in place to evaluate it. So to make all of this successful, we really recognized early on, because there's differences in terms of how research works and policy and practice. Usually there's a bit of a difference in C.E.T., and Christine will talk a little bit about that. What we wanted to make sure was that we would be seen, as valuable. And the last thing we wanted city staff or others to see was, why is this weird research guy coming in for a few meetings here and there, talking, his head off, giving suggestions, and then, disappearing. So Andrea and I very smartly hired Dr. Shepard here as a postdoctoral fellow project. And for those of you who don't know, a postdoc is somebody who's just finished their PhD but is looking to get some additional training. So we hired her to help lead this work and had her physically, sit at the City of Toronto. This was obviously pre-pandemic, but really made sure that she would be there and accessible so that she would be seen as part of the team. Not only to carry out the research, but also to work with them. So if they had questions or other things that needed to be done, that she would be accessible to them. So we took her out of the research lab, which can be quite scary for some people like myself who are quite academic sometimes. And thankfully, she has a great skill set. And thankfully, it's worked out really well. And at this point, I'm going to turn it over to her so she can talk about all the great things that she helped to accomplish as a result of her excellent work.
Thanks so much, Sandra. I'm just going to share my screen on my side here. And make it big. Okay. So thanks so much, Sandra. Today I wanted to give everyone a bit of flavor about some of the research that we carried out to help our partners and support their creation of this new integrated service model. We started this process by working with our city and housing partners to really understand what kind of evidence would actually be helpful for them. What information did they want to have access to in order to support their decision making? So we worked together to form a series of key questions that would guide our work. The first major question that we landed on related to the characteristics of the older adults that lived in the buildings. Our housing partners acknowledged that they don't collect a lot of personal or health information on their tenants. And so while they had some idea of what their needs might be based on their experiences supporting the tenants, they didn't have a lot of information on their physical, mental, and social health characteristics. Next, our partners wanted a much stronger understanding of what it is like to live and work in the buildings. We were really interested in the lived experiences of tenants and partners and wanted to explore what was currently working well in the buildings and what were the challenges. And importantly, how could some of these challenges be addressed in the context of this new integrated service model? And then finally, our partners had questions about what other affordable housing providers were doing to promote successful tenancies for their older adult tenants. They recognize that there's likely a lot of great work happening in other jurisdictions, and so they wanted a way to learn from those successes, challenges, and lessons learned. In response to these questions, we created a bevy of different data sources that could educate and inform the decision-making, and importantly, ensure that all of the major stakeholders who are part of this project have opportunities to share their stories and lived experiences to inform the work. When we were deciding what types of research activities that we wanted to carry out, we worked really closely with our partners at the city to get a sense of their timelines, what information they needed, and how they wanted to use that information so that we could make sure that our methods aligned with those needs. Ultimately, we decided on 5 major research activities as shown up here on the slide. And across these activities, our primary goal was to rapidly process and translate our findings into usable products that the city and our housing partners could use, who were making very fast decisions about this integrated service model. Supporting our partners was our primary goal, and we weaved in methodological rigor so that we could carry out some of our more traditional analyses with an academic lens at a later time. One of the first activities that we did was an environmental scan, and this was done in partnership with the Canadian Urban Institute. They identified 34 different examples of housing programs for older adults that were run by public, private, and nonprofit agencies across Canada, the United States, and Europe. And they all had a focus on integrating health and support services. We worked with our partners at the city to review these 34 models, and we picked 5 that they thought were most similar to what they were trying to accomplish at Toronto Community Housing. And then we conducted follow-up interviews with the staff from those 5 models to learn more about how they developed and implemented their services, as well as what lessons learned they would recommend for someone else trying to implement them. Findings from this environmental scan highlighted the importance of ongoing tenant engagement to understand the needs and interests of the community. For most housing programs, this understanding was facilitated by on-site tenant-facing staff whose focus was on building relationships with tenants. And in most of the models that we examined, health and support services were offered through partnerships with community agencies who worked collaboratively with housing providers to offer flexible, place-based programs in response to the needs of the community. The next thing that we did was a literature review of the academic literature related to seniors housing. You'll recall that one of the key questions that we had for this work was related to understanding who are the tenants that live in the buildings and what are the characteristics of those tenants. We talked with our partners about, maybe we could do a survey, we could ask tenants to share their characteristics, for example, but our partners identified a couple of challenges in conducting such a widespread survey on really tight timelines. And so we decided to turn to the academic literature to see what we could learn from other research studies about the physical, mental, and social health characteristics of older adults who live in social housing communities. We also use this review as an opportunity to learn more broadly about other social housing models, including how they facilitated access to support services. The findings from this review confirmed many observations that our partners had about the tenants they supported, but also identified other challenges that tenants might need support with that they hadn't previously considered. The review also highlighted several ways that the integrated service model might be able to increase access to health and support services. One of the students who helped with this work actually is one of our winners in our student poster competition, and you'll have an opportunity to hear from him this afternoon to learn more about some of the findings from this review. The next thing that we did was a secondary analysis of data looking at the provision of community support services in the buildings. One of the key partners in this project was the Toronto Central Local Health Integration Network, also called the Toronto Central LIN, and I know that's a mouthful of a name. But for all of our non-Ontario participants here, the LINs were our regional health partners that were involved in the planning and funding of health services for the area. And so that would include community support services. And one of the things that's come out consistently across all of the different streams of research that we carried out was how important it is for tenants to have access to these types of services. Things like congregate dining, meal programs, transportation, case management, friendly visiting, in-home health supports. All of those things are so critical to helping tenants thrive and live in vibrant communities. So we partnered with the Toronto Central Inn to look at how these services are provided in the buildings. We wanted to know what types of services are currently there, who is providing them, and how does access to these services vary across the 83 different buildings. At a very high level, the findings showed that there were 56 different agencies that were providing services in the buildings, but only about a third of tenants were actually accessing any of these services. The data also showed that access to services vary widely across buildings. Some buildings had lots of agencies and lots of programs, and other buildings didn't have very much happening. And in some cases, there were many examples of multiple agencies offering duplicative services within the building. So there's lots of opportunities here to learn about service coordination. A planning student from Ryerson University was involved in this work, and she actually also participated in the student poster competition. I urge you all to go take a listen to her poster and check out some of the really cool maps that she made to help visualize this data, as well as learn about the recommendations that we made to our partners to help increase access to these services through the integrated service model. Now, one of the biggest pieces of work that we did, and perhaps the part that I'm most proud of, would be the qualitative interviews that we conducted with both older adult tenants as well as with service providers that work in the buildings. We interviewed 116 people in total, 58 tenants and 58 providers. And these interviews were very semi-structured. They had a bit more of an informal tone because I really just wanted to hear the story. I wanted to hear the narrative of what it is like to live and work in these buildings. I wanted the nitty-gritty details, the good, the bad, and the ugly. And tenants were so eager to sit down and share all of their stories with me. These were incredibly rich interviews. They ranged from 30 minutes to some of them 2 to 2.5 hours long. And we covered so many different topics, including things like what makes their apartment feel like home, how they keep their home in good condition, what it's like to manage their tenancy, what makes them feel safe in the building, how they form or build community, the role of tenant representatives and tenant associations, as well as access to support services and health programs, what types of programs they wanted in their buildings, how they wanted to be able to access them. And you can see from this word cloud that was made based on the transcripts of the interviews, the types of topics that came up quite often. However, there were three things that stood out across almost every interview. Almost every single tenant and every single service provider had a story or a point to make about three things. First was unit condition, and in particular bed bugs, bed bug prep, and bed bug treatment. The next was evictions, including the written notices that people receive about their rental arrears and annual rent reviews, as well as access to services and how to do that more effectively. We took these really big priority issues back to an interdisciplinary group of stakeholders and hosted a half-day consensus meeting to explore the types of strategies or recommendations that could be implemented as part of the integrated service model in order to help improve unit condition, increase access to services, and prevent eviction. We had 72 stakeholders join us from Toronto Community Housing, libraries, community and support service agencies, health and primary care settings, municipal and provincial government agencies, as well as advocacy groups. Some of the recommendations were quite complex strategies that would require much larger system changes to be able to be fully implemented. But they also had several easy, simple recommendations that could be implemented as part of the integrated service model. And these recommendations served as a road plan for our partners as they moved forward and started designing and implementing changes in the buildings. So from about June of 2019 to February of 2020, so maybe about 8 months to a year, we were gathering all of this evidence, and it was being rapidly shared back to our partners in real time to guide their decision-making with this new model that they were creating. And one of the major things that we were able to do as part of this work is to bring forward the vision that tenants and service providers had for this model, what they wanted their communities to look like once changes were fully implemented. Our interviews with senior tenants show that tenants really have four main priorities for this model. They want to live in a home where they feel safe and comfortable and can live with dignity. They want to be part of vibrant communities that support meaningful engagement and participation among their fellow tenants. They wanted spaces where they could lead activities, where they could offer input and shape the way that their buildings and communities function. They want respectful and senior-friendly communication with their landlord and new relationships with staff that are based on trust, transparency, and accountability. And then finally, they wanted access to more health and community services that they know help other tenants be able to remain independent in their home. From the perspective of service providers, they were really hoping that this new model would make it easier for them to form partnerships with housing staff to better support the tenants. From their perspective, they wanted housing staff to have more education about what it is that they do as health partners so that there could be greater awareness and appreciation of the support services that they can provide. Secondly, they wanted new and simplified partnership processes that didn't have as much red tape so that the actual process of forming this relationship with housing was easy and simple. And this includes having access to community spaces to run programs in the buildings, including group recreation and social programs. And they also wanted more opportunities to work collaboratively with housing staff, where they'd have opportunities to apply more of a case management approach collaboratively with housing to identify tenants that need support, link them to services, and monitor their needs over time. These priorities form the foundation of the integrated service model, which has 4 key innovations. I'm not going to go into them right now. If you want to learn more about the model itself and how it's been implemented and how that's going, I suggest you check out the concurrent session this afternoon on aging in place, which includes a talk by Jill Bada from Toronto Community Housing and Andrea Austin from the City of Toronto. This has been a really unique project that brought together research, policy, and the practice spheres, and we're nearing the end of this work, so we've been reflecting with our partners on the impact of our overall approach to what we've been doing. One of the senior tenants that we work very closely with spoke about how this project was the first time that tenants' collective voices, their frustrations and solutions have been listened to and valued. And many of the tenants that we engaged with felt that this work helped open the doors for a different type of more productive communication with their housing provider. In many ways, our approach to this project of talking to tenants and talking to them about what their experiences have been in the building and what ideas they have to do it differently is a very different way of doing things at TCH. Many of the tenants that I spoke to felt that usually the culture is more around information sharing and updates. And as you can see here, one tenant described it as people from housing will come and they'll tell us about all the good work they're doing for us. So very much an information sharing approach, but this project was an opportunity to do it a little differently and to ask them about their experiences and to ask them about their ideas. And the quotes here come from some interviews that I just did this past winter. where tenants expressed just a general appreciation for an opportunity to share their ideas and a desire for more opportunities to do this in the future and wanting to do it more frequently and regularly. From housing staff, our partners have noted that this project really helped them understand the needs of all of their stakeholders, including the tenants, as well as the service providers that they support. And this was something that, they have definitely done in the past, but not to the same extent that we were able to do as part of this project. And as a result, that they are now striving to better align their services for their senior tenants to live independently and thrive within their communities. Our partners at the city have spoke about the opportunities that this project brought for capacity building, and how it created opportunities for both municipal workers and housing workers to develop skills related to tenant and community engagement, research and evaluation, data analysis, and knowledge translation. And one of our partners at the city spoke about how through this partnership, public servants like me can hone and develop our skills, allowing us to perform to a higher standard. So these are skills that they've been able to take forwards to other projects and other aspects of their work and support other projects that they're doing at the municipality. And I'm going to turn it back over to Sandra to get us started with some recommendations about how you all can start building your own partnerships in this way.
Thanks, Christine. So as you heard, Christine has done a ton of work on this project, and from a research standpoint, achieved quite a bit. And overall, I think our approach worked quite well. We can always do things better. Unfortunately, the COVID pandemic had hit. Obviously, we would have liked to have done more engagement with senior tenants, and we did have plans to have a large meeting with them, but unfortunately the pandemic made that a challenge, although we did do some outreach to get feedback from them. As well, even before the initiative started, the City of Toronto had done some outreach and talking to tenants as well, which informed our process as well. But overall, what I'm hoping this shows is that, we tried to put in tools and processes to make sure that what we came up with would be seen as meaningful, hopefully get the necessary buy-in from everybody involved. And we hope that some of what we talked about illustrated this. And I'll just give you our key recommendations and lessons learned, which we think others, and maybe even for some of you, may be able to use when trying to form your own partnerships with different groups. Next slide, please, Christine. And I'll go into more detail about each thing, but I'll give you the quick cheat sheet, for successful academic practice and policy collaborations, which I think are broadly captured in these. One is putting in processes where, all the players working together can identify a series of needs, have a process for gaining consensus on what priorities to focus on, and then try and build in as many opportunities to get feedback. So even though we've come up with the ISM in partnership with all these different organizations, it's still at the pilot phase, and we're still going to build in opportunities for more feedback as it moves forward. We also recognize research practice and policy often face different pressures. And for our team, what we understood was that, those challenges were, we understood what the challenges were, and we really tried to build in flexibility so that we can move our research forward while not really impeding the progress of the planning of the policymakers and the practice. So at the end of the day, it wasn't about the research. It was about making sure would be seen as important and meaningful to the people that it was intended to serve. We also created structures so that we could react in real time to our partners' needs, which helped with communication. And this was most evident by embedding Christine as part of the City of Toronto team. And by doing these things, we're able to build high levels of trust with our partners, which I think made addressing some of the barriers that much easier. Next slide, please. So at critical times, we made the efforts to identify needs, prioritize them, and again, had processes to obtain consensus on a path forward. As I mentioned earlier on, the focus for the grant supporting this work came from a consensus planning meeting where Andre and I got people interested in seniors' health and well-being, and then together we picked housing as the priority. So one recommendation is that if you're going to start something new with a group of people, the academic partner, could put in processes to help with the consensus. So we generally have skills around this. And we also can sometimes find funds to support this kind of work. So again, we were able to get a health grant from the federal government to host the event and talk to people. Second, we also provided opportunities throughout the process to share with stakeholders what we were thinking, what we were learning, and made sure that we could give feedback so that they could have a sense of ownership of the ISM model that we were developing. So this included the large meetings Christine talked about earlier, where we got feedback from people working in TCHC senior buildings, as well as community partners, and in some cases from senior tenants as well. Again, we would have liked to have done much larger events, but the pandemic had started at that point. Christine?
Okay, something we really tried to do from our side as researchers is take a nothing about us without us approach. And in this case, the us is really multiple groups. There's multiple us. The first and most important group at the heart of all of this is obviously the tenants who live in the buildings. And we knew it was important to prioritize their experiences and really make sure that we understand what it's like for them to live in the buildings and have that experience be captured and heard by the decision makers who were trying to make changes in those buildings. We tried to hear from a diverse group of tenants as well to make sure that the voices we were hearing represented the diversity of the seniors that live in these buildings. So for example, those who were new to TCHC and those who were longstanding tenants, those who live with a spouse versus those who live alone, those who are working, those who are retired, those who speak a language other than English. Really a lot of effort to make sure that we're not just hearing one voice, but a collective voice of all the tenants. Another important voice we wanted to capture in this project was that of our health and community support service partners who live and work in these buildings, sort of day in and out. And we wanted to hear from a variety of providers who worked in, different buildings across the city from different agencies and carry out different roles. We heard from social workers and nurse practitioners and psychiatrists and housing staff and community support service staff. And we had a mix of frontline and managers. So we really tried to hear from all of these different people that provide such a wealth and range of services in the buildings. And lastly, the last two groups that we obviously worked extremely closely with were our municipal and our housing partners. So we worked really closely with them to make sure that they had opportunities to help us co-create our research plan so that it wasn't just researchers coming in and saying, this is what we're going to do, this is the best way forward. We really worked with them to understand, what is going to be the best way forward for all of us and how can we as researchers help you get the information and evidence that you need to support your decisions. And this ultimately just makes it more likely that our findings are actually useful to them, which makes us as researchers feel really good. Because I was an embedded researcher with this project, we had really good channels of communication. And this embedded approach really facilitated that communication because I was accessible and seen as part of the team. And this role helped me build much stronger relationships with people who are external to the research, so people who are working at the city and people who are working in housing. And all of this led to stronger feelings of trust that I understood the pressures that they were facing in this policy and practice world, trust that I understand their needs, and trust that I will be able to collect data that can fulfill that need, and trust that I'm going to be able to share my information in a credible and accessible format that they're actually going to be able to use to enhance their work. Because I was embedded, I was able to respond to different requests that our city and housing partners had as the project evolved. A really great example of this came last fall, actually, when our housing partners were conducting a tenant experience survey with a set of pilot buildings. And they wanted some help supporting the design of the survey and coming up with a plan to actually collect the data from the tenants. And so we helped them create the questions, and then we worked with a tenant leader who's here today. Hi, Maureen. To conduct 2 focus groups in her building with some tenants to get some feedback on what we were asking in the survey, whether they liked all the questions, could they understand the survey, and really importantly, get their input on how to facilitate the survey in the buildings so that tenants would actually want to fill it out for us. And this type of tenant input was actually incredibly important because we got a nearly 50% response rate, which is unheard of for this particular group, bringing in almost 1,200 survey responses. So I think our housing partners are really, really proud of this, and this has really been a great opportunity to work collaboratively with tenants to create an opportunity for tenants to give feedbacks in ways that is easy for them. Because I was embedded, it was also a really great opportunity for me to teach our partners about academic processes. And this has helped us think about other projects or other opportunities where we could come together in a partnership to support some other work that the city is leading. So we've applied to several other grants that have come up to help support some of the other work that might be going on. Now, this role of an embedded research is about so much more than just my ability to design a survey or conduct a couple of interviews. To be really successful as an academic partner in this type of relationship with policy and practice teams, you have to be very flexible. And you don't want to be seen as that weird researcher who doesn't understand the context, who has no idea how to communicate their findings, and is just sort of like off doing their own thing on the side. So I had to draw on and develop a lot of different skills related to things like implementation science, program evaluation, stakeholder engagement, knowledge translation, and data visualization. Those last two, knowledge translation and data viz, I think have been probably the most important parts of this project. Our traditional ways of communicating in academia typically don't work well for our partners who work in the policy and practice sphere. And they don't train you in your PhD how to communicate with other groups. They train you how to communicate with other PhDs, but not with other people. So you really have to be very creative and flexible to make sure that you're presenting your findings in multiple ways, because there's lots of stakeholders in the policy and practice world that all have slightly different information needs. And you have to make sure that you're able to present ways and findings that are going to be meaningful for all of these different stakeholder groups. So for example, how we might want to communicate or engage with tenants might be very different than how we might want to do that with a city councillor or a senior manager at the City of Toronto. So we needed lots of flexibility and creativity in order to respond to that. Which leads me to my last point, which is really about balancing needs. And one of the biggest things we had to do in this project was balance the needs and priorities of all of our partners. As researchers, we know things like doing our ethics or data sharing agreements take a lot of time. And we also want to make sure that we're building in a certain level of methodological rigor so that we can publish our findings after. But our policy and practice partners want things done very, very quickly. And in this particular project, there was lots of political and social pressures to make decisions and have an impact in the buildings very quickly, so it became a bit of a balancing act to make sure that we're working fast enough to keep the flow of information going to our partners, while still ensuring that we're able to do a deeper analysis and publish our findings at a later time. And so in related to this, it sort of felt a little bit like as a researcher, we were like the tortoise sort of like chugging along slow and steady, but that our partners in policy and practice really needed to race as fast as possible. And tenants in particular, I find, are just so eager to see changes coming in their building. And so you really have to beware of the bureaucracy and the red tape that exists in all of these fields. And we actually just had a really good example of some of this red tape come up, linking back to that tenant experience survey. Our partners asked us to help support some data analyses. And so they did a great job collecting the data and getting it ready for analysis. And then we dropped the ball a little bit on our end with our red tape and didn't get the legal agreement going at a fast enough pace. And as a result, it's been a couple of months now sort of working out this legal agreement so that we were able to share the data to help them with the analysis. And so that's had an impact on our timeline. So it is really important to be aware of all of the red tape that exists in all of these spheres and make sure that we're able to build that timeline into the approach so that you don't end up behind, that you can stay on top, and that you're able to very quickly turn things around for our partners.
And I'm just going to end off, and I wanted to end off because there was a unicorn on this slide. So I think the last thing is, our tip is to find your policy or academic unicorn. A colleague of mine many years ago, when I was talking about the work I was doing, I was talking about how great it was to work with Andrea Austin, and that we've had a long-standing relationship. And he said, "Oh, you found your unicorn," because a lot of times in policy, people move around quite quickly. So again, we've been very fortunate to have that relationship with Andrea. But the message is when you find people who share similar goals that you actually like, I hope I'm liked by Andrea, and you need to put in the necessary effort to maintain those relationships. Because if you don't do that, then you're going to stay completely siloed and not be able to achieve anything. And then you're going to have to start from scratch each time, and that minimizes opportunities for policymakers and academics to find ways to work together. So I'm just going to end by thanking all of our collaborators. Next slide, Christine. Because obviously we had a very large team of a great set of people working on this, and are really appreciative of all the support for this project. So I'm going to end here because I know we're running a little bit behind. So thank you, everyone.
Sandra and Christine. Hi, everyone. I'm Emma. I'm just jumping in, and we're really appreciative of Sandra and Christine for giving the keynote today. We are a little bit over time, but we're going to just try to get to one or two questions, and then we will jump into our break. So there were a number of questions that came into our Q&A, so thank you, everyone, for participating and engaging in that. So I'm actually just going to go to the questions that are the most upvoted, so we really appreciate people participating and upvoted. So Christine and Sandra, the first question, the top question there in the Q&A is, were there any findings in regards to something tenants wanted but the project was unable to achieve? So something to strive for and work towards. So any reflections on that? And thanks for the great question.
Yeah, I think one of the things that really struck me when I was doing the interviews with tenants is how much is going on in the buildings. There's sometimes safety concerns, there's bed bug issues, there's hoarding stuff. Like there's lots of complexities going on in these buildings. And unfortunately, the integrated service model is not designed to address every single problem in the building. It has a very defined scope of what it's trying to achieve, a very set of defined goals. And certainly I think that it could have some indirect effects. So for example, a new staffing model that has more staff in the buildings might indirectly have an impact on some of the safety issues that are happening in some of the buildings. But there's not necessarily a defined intervention to address safety concerns, for example. So I think that was something that was also really difficult for me as well, because I'm hearing all of these problems and all of these experiences, but the integrated service model is not necessarily being designed to address all of those problems and issues that have come up.
Great, thanks, Christine. Sandra, you have anything to add, or should I move on?
Just move on. I know time's short.
Awesome. Okay, so the next question, actually, I think, Sandra, this would be a good one for you. What should folks, researchers, practitioners be aware of if they want to try to take implementation science approach to designing housing interventions in their own contexts?
So yeah, this is something that I stumbled upon, again, working in healthcare, where we were using it to look at new models of care in the hospital. And I think what it's good to be aware of is to find a model that's going to work for you. There are a number of different models that are out there. When research, we like theory to guide our thinking, what kind of approaches. So the thing about it is, it's just a tool that's available. We weren't completely dogmatic that we had to follow each step of the model that was laid out. We looked at the parts that were relevant. Again, it's just a way to make sure that we weren't just focused on the end goal, that we're just developing the integrated service model. But really what it does is flag out different considerations around the implementation. So are we putting in processes where we're asking tenants what they want? Are we thinking about what are the concerns around staff? So it's really just sort of helping you, take that 10,000-foot look at the whole scenario. And again, with implementation science, it's not about creating something and then being able to replicate it automatically to building to building. Every building is going to have a different set of tenants, different staff, different relationships. So the idea is to sort of make sure that you're asking the right questions and taking into account all those different things, so that the ISM model will maybe roll out at different buildings, but how it looks and how it's rolled out might be slightly different depending on the nature of the tenants and the staff, those type of things. So it's really about using it as one tool and not to be so too rigid, because sometimes in research, we can get quite rigid about our methods, but in this case, we really try to, it's working quite well for this, but there's other things that are out there that might be better suited to answer the questions that we need. So I don't know if that answers the question, but that's my experience with it.
Thanks so much, Sander. I think we might have time for one or two more questions. Just for everyone's reference, what we're going to do is we're going to go to 1:25 p.m. Eastern time here, and then we're going to push our break we're going to have a 10-minute break, and then we're going to go to 1:35, and we're going to start our breakout sessions at 1:35. So thanks so much for everyone. We really appreciate the flexibility. We started off a little bit, we had some tech issues at the beginning, so that's what we're going to do today. So can you, Christina and Sandra, can you speak at all to how and if you think the research could extend to seniors who may have similar housing needs, requirements, wants, but may not live in a public housing context. So, of course, your research is about Toronto community housing, but you conducted other research, the jurisdictional scan, and looked at other kind of housing contexts. So do you think there's any parallels to what you were looking at and other housing contexts?
I mean, I can start, Sandra, and then maybe you can jump in. I think there's a couple of things. Number one, I think a lot of the experiences that I heard about are not unique to Toronto community housing. I think they're probably quite common in other social housing buildings, and whether you're a nonprofit or a municipal run building. I think it's also, a lot of them are probably also common in market rent apartment buildings. I think there's a lot of common challenges that were discussed here. And I think, as we heard yesterday from some talks with Jennifer Malinsky and Shelley Versi, that there's a really big push right now to figure out how we can better support people to stay safely in their homes, and how our policy thinking around health services and housing services need to be less siloed and sort of move closer together. So I think there's actually a lot of really great opportunities for other housing providers, whatever your context is, to learn from this approach. It was really interesting to read the environmental scan and see what types of similar models, like what types of similarities exist in the different models across all these different sectors, and how different groups are providing services. And I think we'll see some of that this afternoon as well in the talk on aging in place, because I know the housing model in Edmonton with Shanika is very different than what we're doing in Toronto with Toronto Community Housing. So I think there's some great opportunities there. And one of the things that we wanted to do as part of this project was to create a toolkit. So now that we're nearing the end, what can we put up and package in a toolkit type format that other providers, other health partners, other city partners in different parts of the US might be able to use to help apply this approach and carry out something in their own buildings to improve their services.
And the only thing I would add is that, I've done this approach in different topics in the different areas. I really, wash, rinse, and repeat a lot of the things I do. I wish I could say I had brilliant ideas every time a new project came along. But a lot of the times, it's the same process. It's bringing people together, talking with them about what the issues are, trying to get consensus. So we could do the same approach again with a different housing model anywhere across the country. It's just putting in the right structures, processes to get the information, get consensus, find priorities, and then try and build in as many opportunities for feedback. So it's very flexible. It's been, knock on wood, successful for a number of my projects. And again, I really have to give credit to Christine because she's, been fantastic and has all the right social skills that I'm lacking being at a research lab full time.
Thanks so much, both. So with just what we're just wrapping up, so just really quickly, if you had more time and resources, what other areas would you like to explore in this area of all of this great research work that you've done?
That's a great question. Going back to that consensus meeting we hosted, we got really lucky. We got that in February of 2020. And we were planning one with 100 tenants for April of 2020, which was right in the middle of all of our